referred to as community health centers. This is America's safety net that began in the 1960s as part of the country's war on poverty, and were authorized under Section 330 of the U.S. Public Health Service Act. This gives us an auto designation with our HPSIP, which is our health professional shortage areas, as we serve medically underserved areas and populations across the state of Florida. When it comes to 330 grantees, you'll hear them called a few different things. Most of them are 330Es, which are community health centers. However, especially here in Florida, we also have a 330G for our migrant health centers, an H for our homeless health center populations, and an I for public housing health centers as well. So sometimes people ask about different partners or get us confused with other entities, and these are our fantastic partners that we're so happy to have on board with us, but they aren't an FQHC. So what isn't an FQHC? Just a few examples here: county health departments, free clinics, rural health clinics, and private practices. So with the FQHC designation, it is a very robust process, particularly in regard to getting started and then maintaining your accreditation over time. So I talked a little bit about our board of directors. They are the CEOs of the FQHCs. At the FQHCs, their board of directors is patient majority, which really helps us guide patient-centered care, with at least 51% of their board of directors receiving services at their respective community health center. They go through robust strategic plannings, audits, and collaborations on hours of operation, staffing, and annual operating reporting as well. So past the requirements, there are many benefits to becoming an FQHC. We have an enhanced Medicaid reimbursement. You'll hear that termed the PPS model. We're also able to recruit clinicians through the National Health Service Corps loan repayment program, and that's incredibly vital to us. We do have malpractice protection through FTCA. We participate in the 340B pharmaceutical program, and this also makes us eligible for many other BPHC grants and loans that are available. Something that is growing, especially here in Florida, is adding the teaching health center designation to our operations. And sometimes you'll hear FQHC lookalikes. What does that mean? They are FQHC lookalikes with all the programs, services, and benefits, but without the funding yet. And they'll have the opportunity to do that as they move forward. So a little bit of a national context here. There are 1,300 plus 330 grantee organizations and 108 lookalikes across the country, with a little over 16,000 listed 330 locations. And look at the patients served at 31,148,000 plus patients. And that's an increase since 2017 of 11%. Over 98 million clinic visits, with over 26 million virtual visits happen each year, with a breakdown there in a little bit of our FTEs nationally of 270,000 for an economic impact of over $63 billion. This is a breakdown of a little bit of what we report on. It's what's called our UDS report, our Unified Data System, with about 38% of our patients reporting as minority on the national context, almost 25% reported in languages best served other than English, and about 67% report below poverty. So meanwhile, back here in Florida, we have 54 federally qualified health centers and well over 850 locations, growing all the time. And we served about 1.7 plus million patients, with an increase of about 15% since 2017. And we have about 5.3 million clinic visits, with more than 700,000 virtual visits. And a little bit there about our workforce, with a $3.2 billion economic impact. And very similar here with the breakdown of minorities and poverty levels that we serve. This is a map of the beautiful great state of Florida, with those locations that I mentioned, with the 54 FQHCs and 850 plus locations. So a little bit about my program is that it's led by a clinician advisory council that consists of 5 chief medical officers, a chief dental officer, and a behavioral health director at the respective FQHCs. And we hold monthly roundtables, webinars, a clinical track at our large annual meeting. And for the first time, we have a very special clinicians retreat planned for the end of this year, as we address the ever cumbersome concerns of burnout. We work off of various HRSA clinical priorities, with just a few mentioned here. And this runs across chronic disease, cancer prevention, STI prevention, always with a focus on social drivers of health. Past the HRSA clinical projects, we have special projects that we work on that are based specifically on the needs that we see here in our state. And here's just a few of those listings. And I also serve on the Lieutenant Governor and State Surgeon General's routine screening roundtable, along with priority area work groups for those related concerns. I put this slide up just to talk about how important social drivers are to the work that we do in regard to contributors to health, with socioeconomic factors, the physical environment, and health behaviors that all lead into the 20% of healthcare here. A few of the HRSA clinical care measures talk about catching up on immunizations, vaccinations for children, dental sealants for children 6 to 9. And then we're always working on our preventative screenings for all adults, colonoscopies, pap smears, tobacco use, and always focusing on mental health, behavioral health, specifically with depression and anxiety. Prenatal care is a big one for us too, as we work on maternal health. We are a primary care medical home in the state of Florida, and we achieved this many years ago and are very proud of that. In addition, we really can't talk about FQHCs without talking about emergent health issues. So nationally, FQHCs are always on the front lines in any natural disaster or emergency. In particular, we played a very vital role with COVID testing and vaccination. And we also respond to the opioid crisis here in the state of Florida, as well as our part in ending the HIV epidemic across the United States. So that is just a snippet of the national and state context regarding federally qualified health centers or community health centers. And I really appreciate the opportunity to be with you all today. Thank you.